Good morning, good afternoon, and good evening to everyone. Thank you very much for joining us today. It is our great pleasure to welcome you for today on this information session focused on the 2021 Annual Enrollment Campaign. We have decided to organize separate information sessions for the US-based plans, the UN Worldwide Plan, and the UN MIP. Today is the first session in a series of 4. This session is dedicated to the US-based plans, which target all of us, staff, retirees, and eligible dependents who are planning to seek healthcare in the US in the next plan year and are stationed at the headquarters or at other duty stations. Tomorrow at 9 a.m. New York time, we will organize a session on the UN Worldwide Plan covering internationally recruited UN staff, retirees, and their eligible family members serving at designated duty stations away from the headquarters. And on Thursday at 9 a.m. Eastern Standard Time, a session will be dedicated to the UN MIP participants. The UN Medical Insurance Plan, or MIP, covers locally recruited UN Secretariat staff, retirees, and their eligible family members serving at designated duty stations away from the headquarters. We will repeat this UN MIP session in French next Tuesday at 9 a.m. New York time as well. My name is Julie Boré, Communications Officer at the UN Health and Life Insurance section, and I will be your speaker for today. We will not need the 2 hours I have foreseen for this session, so I think that's already a good start, but I just wanted to allow enough time for questions and answers. Before I proceed with the presentation, I would like to confirm the recording as well as the presentation will be published on the brand new HLIS website, and that your pre-submitted questions as well as frequently asked questions will also be addressed at the end of the presentation. We will also be happy to answer additional questions which you can submit through the Q&A box of the webinar tool during the presentation. As you might not be able to respond to all questions today, the Health and Life Insurance section, the Health and Life Insurance Committee, and the third-party administrators take note of all questions and will make sure that they are answered after the webinar. Please try to limit your questions to questions related to the annual enrollment campaign. If you would submit any personal questions, we will make sure that you still receive a response if they are appropriate, but then we will not publish them during this session. The questions and answers will be published on our website by Friday, 25 June. Please find the link to our new website at the bottom of this slide. With that, let's take a brief look at today's agenda. Today's session will be dedicated to the 2021 Annual Enrollment Campaign. And before jumping into the details of the campaign, we trust it is useful to introduce you to the different health insurance partners. You will learn who these partners are and each one's role and responsibilities in allowing us to continue accessing quality healthcare at affordable rates. Afterwards, we'll guide you through the changes effective 1 July 2021, the actions you should take no later than June 30th, and a summary of the coverage levels under each US-based health insurance plan. For us to take a well-informed decision and choose the plan that fits our and our family's needs best, we will also inform you on the key differences between our self-funded medical insurance plans, Aetna PPO and Empire Blue Cross PPO. In addition, we will provide you with some changes we can all make to avoid financial surprises and steep increases for future premia. The Health and Life Insurance section, in close collaboration with third-party administrators, is continuously monitoring solutions available in the health services space that allow us to take control of our own health. We will discover 3 key services available to us today. We'll conclude today's session with a Q&A and try to cover as many questions as possible without exceeding the foreseen time slot, of course. As a first step, let us talk about today's participants. The information session is hosted by the Health and Life Insurance section, together with the Health and Life Insurance Committee. We are committed to respond to ever evolving health and life insurance needs, nourished by feedback we seek and receive from you, as well as third-party administrators. A team of dedicated benefits assistants responds to your questions in a timely and qualitative manner. Last March, the Health and Life Insurance section launched a survey to measure the satisfaction rate of the services provided by the Health and Life Insurance section, as well as by the third-party administrators. This survey helps us to identify areas for improvement, and while only 15% of the 1,690 participants indicated not to be very satisfied with the services provided by HLIS, the accessibility of health and life insurance related information like a website and broadcast messages was the main driver for dissatisfaction. We immediately acted upon this feedback, and in March we started the creation of a brand new website that provides comprehensive information on the UNHQ administered health and life insurance plans. And the website was published on June 3rd, so very recently. So far, we have received enthusiastic feedback and invite you to explore this new platform at the soonest. The homepage offers you the latest updates from third-party administrators from the Health and Life Insurance section, as well as events organized by HLIS and our partner administrators. Throughout this presentation, I will refer you to specific web pages when applicable, as we trust that the new website provides you with everything you need to know about UNHQ administered health and life insurance, including the onboarding process, plan maintenance, and transition after your retirement. The Health and Life Insurance Committee is a standing body of the Joint Negotiation Committee and is comprised of representatives of staff and management, observers from UNDP, UNICEF, and AFIX, a medical director, the OPPFB director, and health and life insurance section colleagues. The committee reviews and recommends proposals relating to insurance eligibility rules, plan changes, and premium rates for the annual renewals of health insurance plans administered by UN headquarters. The core functions of the Health and Life Insurance Committee include the oversight of plan benefits, proposal of insurance eligibility rules and plan design changes, proposal of premium adjustments for the annual renewals, and an evaluation of exceptions to any insurance eligibility or benefits rules. The colleagues from the UN Health and Life Insurance section, together with the Health and Life Insurance Committee members, welcome three third-party administrators or third TPAs to today's webinar: Aetna, Empire Blue Cross, and Cigna Dental. Aetna and Empire provide medical insurance to you and your families in and outside the United States. Cigna Dental provides a comprehensive dental plan for those seeking dental care in the United States. The third-party administrators will closely monitor and answer questions raised in the chat box pertaining to specific coverage questions that you might have. Therefore, we would like to advise you to be as specific as possible in formulating your responses, your questions, in the chat box by indicating the health insurance plan or service you are seeking information on. Please limit your questions to generic questions pertaining to the 2021 annual insurance campaign. Should you have any specific or personal questions, you may raise them by calling the designated phone number of the third-party administrator or by sending an email to one of the designated email addresses you will find on the last slide of this presentation. Should you already be a plan participant, you will find the contact information on the back of your ID card. But for those who are currently not yet plan participants for either Aetna, Empire, or Cigna Dental, all three third-party administrators made a dedicated phone line available, as well as mailboxes where you can address your questions to. I will share them at the end of the presentation. The reason for organizing this information session is you, our staff, retirees and dependents, mostly participants covered under the US-based health insurance plans or interested in learning what these plans offer to participants, are joining today's session. Most attendees will therefore reside in the United States, but also internationally recruited staff with a duty station outside New York who decide to enroll in a plan that provides adequate coverage in the United States are participating to this information session. Now that you met the webinar participants, we would like to draw your attention to the roles and responsibilities of each partner. The United Nations, in its role of insurer of the self-funded UNHQ administered health insurance plans, the UN Health and Life Insurance section providing comprehensive health and life insurance plans to eligible staff, retirees, and family members, the plan participants of the US-based plans, the knowledgeable consumers of healthcare, and the third-party administrators who are only providing administrative services to us. HLIS conducted more than 20 information sessions in the last 12 months, and we learned that these roles are not widely known. It is, however, very important that we have a common understanding of the roles and responsibilities, as it will allow us to better understand the impact of our medical consumption behavior on all of us. Therefore, I will explain the roles and responsibilities of each of us in the next 2 slides. The United Nations is both a policyholder and the insurer of the UNHQ administered health insurance plans. In its role of insurer, United Nations offers group insurance plans that cover the risk of a person incurring health-related expenses by spreading the risk across all plan participants. By estimating the overall risk of the group of insured based on the actual plan experience, the Health and Life Insurance Committee recommends a premium which is sufficient to ensure that we, together with the organizations, collect sufficient funds to pay for the healthcare benefits specified in the health insurance plans. Through the health insurance plans, the UN offers a substitute to a social security system similar in design and principles to protect us when we risk high health-related expenses. UN headquarters decides on the content of the plans and the plan rules of each health insurance plan. In addition, UN decides on the administrative services the third-party administrators should offer. Claims processing might be the most important responsibility, but many other services are offered to safeguard the sustainability of the plans. The next partner is the UN Health and Life Insurance section in the Department of Management, Strategy, Policy and Compliance. All 26 colleagues in our section are committed to provide excellent client services to eligible staff, retirees and dependents enrolled in our health and life insurance program. This responsibility is not limited to the UN Secretariat only. Staff members in most agencies, funds and programs are eligible to enroll in one of the plans managed by the HLIS. That is how our health insurance plans protect more than 150,000 individuals today. When staff members are enrolled in a UNHQ administered health or life insurance plan, HLIS transmits the insurance information to the respective third-party administrator in an eligibility file. Changes to the health insurance plans, including enrollment or termination of dependents during the enrollment campaign or following a qualifying event, will be reflected in these files. HLIS is also responsible for the review of the adequacy of the UNHQ administered health insurance plans. For this exercise, we use actual plan performance details, including evolution in average claims reimbursed and claims cost per plan participant. And we compare the total program costs with the total premiums collected. The cost of healthcare is skyrocketing. The last decade, the global annual average medical trend rate reached values close to 10%. The global average medical trend rate is outpacing the average general inflation rate. The medical trend rate is defined as a percentage of change in cost of healthcare prior to any cost containment measures undertaken by the policyholders. As the cost of healthcare prior to any, as the premiums we pay together with the member states are calculated based on the actual amount of medical services consumed during the plan year, which runs from July through June, our utilization directly impacts the premiums we pay, and we continuously look for ways to avoid average annual premium increases similar to the annual average medical trend rate. In the current plan year, July 2020 to June 2021, the pandemic has led to a decline in plan utilization during the initial outbreak of the plan year. However, we will have to contribute to contain costs in the next plan year. To avoid steep premium increases in July 2022, I will share some initiatives further down this presentation. The staff toolkit on our website lists additional efforts as well. When reviewing the adequacy of the plans, we also review the feedback provided by third-party administrators and plan participants and verify if benefits and coverage levels are still adequate and meet coverage requirements as stipulated by local authorities. Only then we calculate the impact of suggested plan changes on the premium with the assistance of third-party administrators. And finally, HLIS provides policy and technical support to HR partners, as HR partners are the focal point for staff when changes in family composition like marriage, birth, or divorce occur, or changes in a staff member's personal and professional career, including special leave, reappointment, or retirement happen. We support HR partners to ensure that the eligibility criteria and other UNHQ administered plan principles are well understood. Most important, again, are our plan participants, our fellow colleagues and us. Our plan is funded by the member states and each of us. The General Assembly has mandated a cost-sharing arrangement where for the US-based plans, 33% of total cost is borne by staff and retirees, and 67% of the cost is paid for by the organizations or member states. By keeping our medical expenses under control, we contribute to the long-term sustainability of the plan. Besides partially funding our health plan, we can also help keeping our plan sustainable by reducing our medical expenses to a minimum. This benefits everyone else under the plan, of course, and the lower the total bill, the lower our out-of-pocket expenses will be, and the lower our out-of-pocket expenses, the longer we can benefit from reimbursements before our coverage ceiling is met. I will share some initiatives later on this presentation. And very important in administering our health insurance scheme are the third-party administrators. The US-based plans are administered by Aetna, Empire Blue Cross, and Cigna Dental. The third-party administrators, or as they are known to us as TPAs, interpret the plan rules stipulated by UN headquarters. Third-party administrators process claims for covered benefits that are medically necessary with reasonable and customary expenses. By reasonable and customary, we mean fees and prices that are commonly charged for the treatment or purchase in question. Furthermore, the treatment or purchase must also be reasonable and not questionable, but customary from a medical point of view. This means, for example, that the number of tests, the dosage of medication, etc., should be medically justified. In addition, third-party administrators respond to inquiries from plan participants. These inquiries include benefit questions, reimbursement questions, and pre-certifications. To allow access to care to us, third-party administrators issue personal ID cards and offer a broad selection of in-network providers that allow us to access quality healthcare at preferential rates. All third-party administrators have a provider search functionality on their website you can find for a provider that is in the network. And while our PPO plans allow both in-network and out-of-network treatments, we really want to encourage you to visit in-network providers. I'm sure we all understand that this is not only crucial to ensure the financial sustainability of our plans, it also offers a personal benefits. I will also give you a very concrete example later on this presentation. Now, what will change effective 1 July 2021? There will be no premium changes for any of the UNHQ administered plans, Aetna PPO, Empire Blue Cross PPO, or Cigna Dental. As I indicated before, the start of this pandemic started in the early stages of this plan year. We saw a decline in plan utilization. Of course, utilization is picking up again, and we just have to be very cautious there. But the premium rate for the HIP plan will increase by 6.41%. As from 1 July 2013, As from 1 July 2013, the HIP Health Plan of New York is closed to new subscribers. Subscribers who are currently covered under the HIP plan can remain in that plan, and they can also add eligible family members who will be accepted. However, a current subscriber who transfers to another US-based plan during the 2021 annual campaign will not be allowed to return to the HIP plan in future annual campaigns. Therefore, we are allowed to change from HIP to another health insurance plan, but no one is allowed to join the HIP plan. Both Aetna and Empire plans will cover telephone and video consultations with in-network and out-of-network service providers. These enhancements were already introduced at the outbreak of the COVID-19 pandemic, early April 2020. However, they will be embedded in the plan design as a new benefit effective July 1st. As we prepare for the new normal, we can hardly imagine a medical world without possibility to consult a doctor from the comfort of our homes. I would like to remind you that these consultations will not yield any financial benefits to our plans. Aetna and Empire still offer telehealth consultations through respectively Teladoc and Live Health Online. These services are cheaper, so you will avoid costs on the plan should you use these services instead. Let me see, this slide summarizes the last service update from TPAs. You will also see these updates reflected on our website, but I just wanted to ensure that and seize this opportunity to also guide you through these important updates. Aetna introduced RX prior authorization on May 7th. Aetna has a number of alerts in place to keep us posted on our status to help reduce calls into the call center and thereby improving member experience. The purpose is to keep us informed of any additional expense we may need to incur. This new alert will inform us when a pharmacy prior authorization is submitted by a doctor and when an authorization is approved or denied. Empire introduces 2 new programs on July 1. Condition Care provides members who have any one of the 5 core chronic conditions, diabetes, asthma, heart failure, coronary artery disease, and chronic obstructive pulmonary disease, with access to education and goal-oriented health coaching from registered nurses. Members learn self-management techniques that help to improve their quality of life, increase adherence to medical best practices, and avoid costly condition-related complications. The Empire Health Guide helps us through our healthcare journey by matching us with doctors, scheduling consultations online, and making warm referrals. You will receive additional information from Empire on these new programs. And Cigna Dental will continue to offer virtual care as well, 24 hours a day, 7 days a week, 365 days a year. Cigna Dental virtual care consults are processed as in-network claims on our plan and have no copay or co-insurance. Although Cigna Dental virtual care consults do not apply to the frequency limits we have on our plan, they do apply to our plan's annual maximum. What are the key services already available to us? I think this is a very important reminder, because in addition to the benefits offered under the health insurance services, we acknowledge now more than ever the importance of offering health and well-being services as well. All US-based plans provide online consultations to enable us to connect with a licensed doctor or medical care provider by phone, video, or mobile. Both Aetna and Empire have their own online platforms. Aetna offers an online app called Teladoc, whereas Empire offers an online app called Live Health Online. To use the benefits of online consultations, we must enroll by going to the website of the respective carriers. There is no additional cost for enrolling to these benefits. The Active Health Program provides confidential health and wellness support to Aetna and Empire plan participants. We can access a variety of tools and resources to help us achieve our health goals, like eating better, be more active, and better manage a health condition. It allows us to track our health, look up symptoms, and find healthy recipes. Additionally, provides active health support for learning how to manage a new diagnosis or managing a chronic condition. We can download Active Health mobile application in the Apple Store or Google Play. And lastly, United Healthcare Global Assistance and Risk is another program available to Aetna and Empire members, providing emergency medical assistance management, including coordinating emergency evacuation and repatriation, and other travel assistance services when we are 100 or more miles away from home. In this slide, I would like to zoom into the benefits of active health, as the users of this service value active health very much. To get started, you just visit myactivehealth.com/United Nations and take the health assessment. This assessment will help you find ways to improve your health, may help prevent health problems before they occur, and provide helpful tips for living a healthier life, and also includes a detailed report on your health. In addition, you will have access to health coaching, which provides helpful advice based on the results. Active Health will send you personal health actions to help you on your way, but we set the tone and pace. We also choose when and how to interact with Active Health, and we can always contact the Active Health team directly through calls or secure messages. Last September, HLIS organized 2 very successful Lunch and Learn sessions together with Active Health on the importance of knowing your biometrics. On July 1st, we will organize 2 more Lunch and Learn sessions on stress management. With many of us returning to the office soon and stress being among the top 3 chronic conditions today, we would like to support you on how you can organize time, prioritize what is important, and take control of your life. The sessions are already published on our event calendar on the HLIS website. The flyer with registration links will follow in 2 days. Here you can see how the flyer will look like. So you see 2 sessions, one at 11 a.m. and one at 1 p.m. New York time on July 1st. Then on this slide, you will find a high-level overview of the coverage under the medical plans of Aetna and Empire, as well as the coverage under the Cigna dental plan. The chart mainly lists overall coverage levels for in-network and out-of-network providers and clearly shows how we will all benefit from visiting in-network providers to avoid financial surprises. It is our responsibility to thoroughly review the benefits covered under each medical plan prior to selecting the plan that meets our family's needs best. The 2 medical plans cover other benefits and offer sometimes different maximums to similar benefits. The Cigna dental plan covers diagnostic, preventive, restorative, and orthodontic care. Last year, we introduced temporary updates as the pandemic made getting preventive dental care at the end of the last plan year nearly impossible. Class 1 services did not apply to the annual maximum, which gave us a higher budget for restorative and orthodontic care during the ongoing plan year. And secondly, participants who did not have diagnostic or preventive care rendered in the prior plan year did not regress to a lower annual maximum benefit this plan year. However, now for the next plan year, starting July 1st, these updates will no longer apply. As the overview presented on the slide will not answer specific questions you may have, we kindly invite you again to look for the details in the information circular, the benefit booklets, and other documentation available on our website. And in addition, we have requested the third-party administrators to allow you and staff to address benefits questions. This will allow us to ask specific questions that will allow you to make an informed decision on which plan to choose. Visit in-network providers, an example. Let's have a look at an example of the different coverage levels for in-network versus out-of-network providers under Aetna and Empire. This example is about a participant who goes for a surgery and to an in-network provider. The price list cost is $20,000. A discount of $6,000 is granted. The plan reimburses 100% of the rate charged, as this is the coverage level for in-network care. If the same plan participant goes to an out-of-network provider, where again the same outpatient surgery will cost $20,000, but there's no network discount, the rate charge is still $20,000, of which the plan participant will pay $4,200, and also the plan will pay a higher portion. This generates both a short-term and a long-term negative financial impact, and the co-insurance is higher, and the future premia will increase as well if more participants seek out-of-network care. Therefore, we strongly encourage all participants to seek care in the network to avoid negative financial surprises and to keep our premiums low. All covered specialties are available in the network as their in-network provider if they are part of the network, and if the invoice will be submitted as an in-network claim. And make sure to verify that your treating practitioner is also part of the network, as some facilities offer both in-network and out-of-network caregivers. Now, to make it easier for you to take a well-informed decision on your medical insurance plan for next plan year, we have summarized some key differences between our two US-based plans. First, you will discover that the premium rates between Empire and Aetna are different. The premium rates for the next plan year can be found in the Annex 1 of the new STIC 2021-10. In addition, and thanks to our colleagues in UNDP, we have insurance rate simulators on our website where you can estimate your future premium. We would like to remind you that price should not be the only criterion. You should select the plan that meets the needs of your family best. The plan design comparison shows the most important differences between the two plans. Aetna covers out-of-network inpatient hospital admission at 100%, where the Empire plan covers only 80%. The mental health residential treatment services are only covered under Aetna. So are infertility treatments. They're also only covered under Aetna. Aetna does not apply an annual maximum for physical and occupational therapies, but is very strict in the medical reviews, covering strictly medically necessary care only, whereas Empire limits reimbursements up to a total of 60 sessions annually. But dear colleagues and former colleagues, please be reminded that this is the UN, your organization, who stipulates these rules. As coverage will always depend on your specific medical case, we invite you to contact Aetna and Empire directly to inquire more details on your specific case. I remind you that the dedicated contact details will be shared on the last slide of this presentation. In addition, you will find plan details, leaflets, and specific benefits like infertility treatment and mental health care benefits on our website. Now, what action should you take no later than June 30th? The annual enrollment campaign is the only opportunity to make changes to your health insurance plan. The system will automatically end the campaign period at on that date, on the 30th of June, and all changes will be effective July 1, 2021. After 30 June, no further actions can be completed without a qualifying work or live event. That being said, please review your current health insurance coverage in your organization's ERP system. Are you enrolled? In which plan are you enrolled? Are all eligible family members enrolled as well? Read about the different plan options on the HLIS website and contact Empire, Aetna, or Cigna Dental through the dedicated channels should you have specific coverage questions. In addition, you can estimate your future premium through the insurance rate simulator on the HLIS website to get a good indication of your continuation under each plan, as well as the organization's subsidy. If desired, make a change to your health insurance plan by 30th June 2021 For UN Secretariat staff, this will happen in Umoja ESS. But can I please remind you to print a confirmation in ESS when the changes are made? This confirmation is sufficient and you should not seek further confirmation with our HLIS colleagues. You will understand that the inflow of emails in our HLIS mailboxes is exceptionally high this time of the year, and therefore we kindly ask you to seek any further confirmations with our benefits assistants as a proof of confirmation in Umoja is definitely legitimate. So do not reach out to our HLIS mailboxes. You can just easily print it. The annual enrollment page on our website guides you through the process of how to make changes and how to add or delete a dependent. And you will also read how a confirmation can be printed. Staff from other organizations will need to complete the annual enrollment form on our website. You can do this electronically and submit the same to your respective organization. Because we have now editable forms as well. What changes can you make in June? 2021 annual enrollment campaign is the only opportunity until the next plan year or the next campaign in June 2022 to enroll or terminate enrollment in the United Nations headquarters administered health insurance program. You can change to another plan and or add or terminate coverage for eligible dependents. Aside from the specific qualifying events such as marriage, divorce, death, birth or adoption of a child or transfer within the United Nations system, for which special provisions for enrollment between annual enrollment campaigns are established. Our information circular provides information on these qualifying events for enrollment and termination outside the annual enrollment campaign period. While enrollment is voluntary, we advise staff to seriously consider enrollment in a UNHQ administered health insurance plan, as they offer rich benefits and are for 67% funded by the member states. Now, what are ways to avoid surprises and steep increases for future premium? Before we move to the annual enrollment campaign contact details and Q&A, I would like to summarize once again some important ways to avoid surprises and steep increases for future premium. Whereas the last plan year was heavily impacted by the COVID-19 pandemic and we noticed a decrease in plan utilization as less participants sought care, we cannot expect this underutilization to continue. While the impact of deferred treatments and long-term healthcare is still unknown, the general expectation is that plan utilization will return to normal levels during 2021, and the global average medical trends rate for 2021 will reach a level of 7.2% again, with poor stress management being a top 3 risk factor driving future adverse medical costs. This is also one of the reasons why we chose this topic for our Lunch and Learn sessions with Active Health to manage stress better. It is a common responsibility of all plan participants of the self-funded UNHQ administered health plans to safeguard the sustainability of the plans and to enjoy minimal premium changes in the coming plan years. How can you do that? You should try to stay in the network. In-network doctors, labs, hospitals, and other healthcare providers charge lower negotiated rates. Plus, your co-insurance is lower, as we have clearly seen in the example I presented to you in slide 13. Ensure that your upcoming treatment is pre-certified. Whereas this is mandatory for inpatient hospital care only, it is strongly recommended for skilled nursing facility, home health care, hospice care, and private duty nursing care. If you go out of the network, it is your responsibility to obtain pre-certification from the third-party administrator for any hospital services. If you do not obtain pre-certification, a $2,500 penalty will apply. You can obtain pre-certification by calling the number on your Aetna or Empire ID card. Then use ER only for emergencies. visit an urgent care center or walk-in clinic for non-life-threatening medical issues. Emergency room visits for non-emergency care are not covered, whereas in-network urgent care is covered at 100% after $15 or $20 copay. Switch to generic drugs where possible. Empire Plan participants utilizing multi-source brand drugs, so that are brand drugs that have generic substitutes, must switch to generic products. If you do not change, you will pay the difference in cost, even if the doctor writes DAW, which is dispensed as written, on the prescription. You must work with your doctor to prescribe a generic drug with therapeutical equivalent ingredients that are the same as the multi-source brand drug you are currently using. This is only applicable to multi-source brand drugs, and these drugs represent less than 3% of total drugs, and they all have generic substitutes with, again, particularly equivalent ingredients. If you need care outside of the United States, find your service providers through for Aetna International, for Empire, Blue Cross Blue Shield Global Core Program. The Aetna Open Choice PPO-POS plan includes automatic enrollment in the Aetna International Program for plan participants who are active staff members at duty stations outside of the United States, and for retirees with a mailing address outside the United States. All correspondence relating to the Aetna International Program will continue to be sent to the mailing address on record in the personal system. International direct billing is not automatic for Aetna domestic members, so with a duty station in the US or mailing address in the US and who are traveling outside the US, but invoices can be paid directly at a healthcare provider and claimed with Aetna domestic afterwards. For Empire Blue Cross participants, coverage when traveling or living outside the United States of America is handled by Blue Cross Blue Shield Global Core. Details can be found in the Empire Blue Cross PPO plan description document or in the leaflet on our website. Now, that brings us to the last slide of this presentation, which I mentioned a couple of times. So what to do next if you have any additional questions related to the plan design, eligibility criteria, changes in Umoja ESS, or should you like to attend another information session or the Lunch and Learn with Active Health on July 1st, visit our new website and find everything you should know about our UNHQ administered health insurance plans. Should you have questions or on benefits coverage, call the dedicated phone line on the back of your card for participants. If you're not yet a plan participant for the respective plan, you can reach out to these dedicated mailboxes and phone numbers. Do you still have questions, or our HLIS team is of course there to help you, and we invite you to complete a contact us form on our website to contact HLIS. We will make sure that after this presentation, this information is also available on our website with the dedicated contact details. So that brings us to the end of this of the presentation. We still have enough time, of course, to cover some of the questions, and we'll make sure to provide you with answers to all questions after this session. We will publish the Q&A document on our website by Friday, 25 June. Now I will see with my colleagues Valentina Bono and Wesley Carlesar, as they are kind enough to guide me through the pre-submitted and frequently asked questions, while other HLIS colleagues and our focal points with third-party administrators will continue to respond to questions you raise in the Q&A box.
Hello, Julie. Hello, colleagues. This is Valentina speaking.
Good morning, Valentina. How are you?
Good. How are you, Julie? Great presentation. I'm going to start with the first question.
Sure.
My duty station is not in New York. Can I enroll in a US-based plan?
Yeah, that's indeed a question that we receive quite often. Yes, you can. So staff members and retirees who are residing, who are considering coverage for themselves or family members residing in the United States of America, or who intend to seek medical care in the United States on a regular basis, are reminded that they should consider enrolling in a United States-based plan during the enrollment campaign in June. The UN Worldwide Plan, which covers internationally recruited staff outside the US, is simply not simply not provide adequate coverage in the US. So if there are any plans to seek care in the United States, staff members and retirees should consider enrolling in a United States-based plan. I hope that answers your question, Valentina.
Got a question here. Someone is asking, what changes can staff members make during the annual enrollment campaign?
Yeah, I think indeed we covered that during the presentation, but it's definitely a very valid question during this presentation, during this enrollment campaign. So there are 3 types of changes staff members can make. Enroll or terminate enrollment in the United Nations headquarters administered insurance program. You can change to another plan, again, Aetna to Empire, Empire to Aetna, or for instance, from a UN Worldwide Plan, should you currently be covered in the UN Worldwide Plan because your duty station or your mailing address is outside the US, and you are planning to seek care in the US in the next plan year. And thirdly, you can add or terminate coverage for eligible dependents outside of a qualifying event. Thank you, Wesley.
Thank you, Julie. Very clear. I will continue with the next question. Yeah. Are additional actions required if staff switch coverage between the Aetna and Empire Blue Cross plans?
Yeah, there are. It's not required, but there is something to keep in mind. So plan participants who switch coverage between the Aetna and the Empire Blue Cross plans and who have met the annual deductible or any portion thereof under either of those plans during the first 6 months of the year, so from January through June 2021, may, under certain conditions, be credited with such deductible payments under the new plan for the second 6 months of the year. The deductible credit will not occur automatically and can be implemented if only one of the plan participants formally requests the deductible credit on the special form designed for that purpose, which can be found, of course, again on our website in the form section, attaches the original explanations of benefits attesting to the level of deductibles met for the calendar year by the plan participant and or eligible cover dependent. To receive the credits, participants must submit a completed form to the section, so HLIS, not to the third-party administrators, via the mailbox again, hlis@un.org, or the Contact Us form on the website. That is even a preferred communication channel, together with the relevant explanation of benefits, and no later than 31 August. So you will have 2 months to take action there.
Thank you, Julie.
Julie, someone is asking, is the annual enrollment campaign open to retirees as well?
The annual enrollment campaign is not open to retirees. I know that we do have some retirees on the webinar because I definitely think it's useful for everyone to join. But the enrollment campaign is not open to retirees. Retirees enrolled in the after-service health insurance program who change their country or primary residence following separation may also transfer from insurance plan to another if a different plan is more appropriate to the new country of residence. With respect to the health insurance plans available to after-service participants who reside in the United States, transfers from one plan to another may be made subject to the condition that there must be 2 years coverage under any such plan before a change can be made. Therefore, the annual enrollment campaign is not open to retirees, and retirees like active staff can only be enrolled in the UN Worldwide Plan when residing outside the US. So just to clarify, every 2 years, the minimum period of coverage under one plan is one US-based plan before changing to another US-based plan is 2 years, and afterwards a change can be requested. Thank you, Wesley.
Okay, next question. How much will it cost to enroll in Active Health?
Yeah, so both Active Health as United Healthcare, United Health Risk come at no additional costs, or at least no additional out-of-pocket costs. So the cost is just embedded in the premium. Aetna and Empire Blue Cross plan participants will all have access to Active Health. The only thing you should do is indeed, as instructed before, activate your profile and start discovering the world of Active Health. While you will not pay any additional cost, the advantages of enrolling in the program are numerous, and all plan participants are definitely strongly encouraged to activate the Active Health account on, again, myactivehealth.com/United Nations.
Okay, Julie, someone here is asking, when can I expect my new ID card? Should I decide to enroll in a new health insurance plan effective 1st July 2021?
Yeah, so the cards are, of course, shipped by the third-party administrators. This is definitely one of the responsibilities of the third-party administrators to issue membership cards. They are shipped to the subscribers' mailing addresses on average 10 business days after the upload of the insurance eligibility file, which is transmitted from Health and Life Insurance section or from the other participating organizations to the insurance carriers. It's start of month or mid-month, so twice a month the eligibility files are transmitted and uploaded. But please allow for 1 month upon enrollment, as it might take, of course, a little bit longer, but you will be covered as of the 1st of July.
Exactly, Julie. I think you already answered the question that was coming next, and it was the question was, when will my new coverage go into effect?
Yeah, okay, so indeed it is the 1st of July. So even if you make a change on the morning of the 30th of June, your new coverage will go into effect on the 1st of July. We often receive these kind of questions, but indeed this is actually how it happens. So in the system, the change needs to be made by the 30th of June. And then on the 1st of July, an eligibility file will be transmitted to the third-party administrators. Thank you, Valentina.
Julie, is any action required by the plan member to start infertility treatment?
Yes, their actions are required. A plan participant does require pre-certification through the infertility group, and the member must enroll in the National Infertility Unit. I think it's very important for everyone to know indeed that this action is required. And guidance is also provided on our website, because there are some infertility treatment leaflets published on there. But of course, Aetna will also be more than happy to guide you through the process. When there's a plan for infertility treatment using one of the following treatments, again, advanced reproductive technology, artificial insemination, or ovulation induction with injectable infertility medications, then pre-certification is required. Participants do not need to enroll when requesting an initial consult. I think that should be clear as well, or diagnostic workup, right? Because these services do not require authorization. So it's really that first conversation one would have with a specialist. It will be covered just under the plan benefits, right? Coverage levels. 100% in network, it would be 100% after $15 or $20 copay. Thank you, Wesley.
Which family members are eligible to enroll in my health insurance plan?
Yeah, another frequently asked question. So eligible family members, and it's also very clearly stipulated in our policy documents, do not include secondary dependents. So family members of temporary staff members are also not included, at least not when they have appointments of less than 3 months, or family members of occasional workers, and just secondary dependents, to make sure that everyone is aligned on the definition. These are parents, these are siblings, these are grandparents, these are grandchildren, these are secondary dependents. So it's really limited to spouses and children. So the term eligible family members, as it's stipulated in our STIC, refers to a recognized spouse and one or more dependent children. The United Nations Health Insurance Program recognizes only one eligible spouse for coverage, and a dependent child is one who meets the definition according to staff rules and is a household member in, again, UMOJA system for United Nations staff, Secretariat staff, the Atlas system for UNDP, SAP system for UNICEF, and one UNOPS for UNOPS colleagues. A child is eligible to be covered under the program until the end of the calendar year in which he or she attains 25, provided that the child is not married nor full-time employed. Exceptions are made, of course, for children with disabilities. They may be eligible for continued coverage beyond the age of 25 if they are certified with a disability by the Division of Healthcare Management and Occupational Safety and Health, so DMOSH colleagues, if the parent is an active staff member, or by the United Nations Joint Pension Fund if the parent is a retiree.
Good, and this is an eligibility question. My child will turn 21 this year. Will he or she still be covered?
Yeah, so I think that was also covered already in the previous question, but I think this is a more practical example. So yes, however, children are covered until the year in which they attain the age of 25. It's very important, provided that they are not married or full-time employed. So when your child gets married or full-time employed, we have to be aware of it. We have to be notified, and the insurance coverage will be terminated at the end of that month of the event, which is either the marriage or the moment, the contract start date of the full-time employment. Thank you, Wesley.
Hello, Julie. The next question is about fraud, waste and abuse, and it is, how can I help fighting fraud, waste and abuse?
Yeah.
Thank you.
Thank you. So HLIS launched a fraud, waste and abuse campaign earlier this year, as it is very important also for everyone to understand what it is, fraud, waste and abuse in the health insurance world. So you are very important, I think, and a very easy one is you are strongly encouraged to review your explanation of benefits or settlement notes, how you call it, or claim statements carefully to ensure that only services you received from the provider are billed. Furthermore, it is also the responsibility of the plan participants to report any questionable charges to the third-party administrator so they can be investigated. And more information can be found on the website in the Active Staff Toolkit with a leaflet on what is fraud, what is UN's opinion against fraud, waste and abuse, and how can we all fight it, right, as plan participants. Thank you.
How are benefits coordinated if I'm covered by 2 or more plans?
Yeah, so if you're covered under, if you have several health insurance coverages, the United Health Insurance Program does not reimburse the cost of services that have been or are expected to be reimbursed under another insurance. I think Medicare is a very good example there. another insurance or a social security system or any similar arrangements. For those participants covered by 2 or more plans, the United Nations Health Insurance Program coordinates benefits to ensure that the participant receives as much coverage as possible, but not in excess of expenses incurred. So the plan participants covered under the United Nations Health Insurance Program are expected to advise the third-party administrators when a claim can also be made against another insurance company. Thank you.
Hello, Julie. Can I make changes to my insurance coverage between annual enrollment campaigns?
Yeah. So that is indeed one of the exceptions I mentioned before. However, it is very important, of course, that everyone is aware of these qualifying events. I will just list them here, but of course, I really prefer you to also go to the STIC and get the full list of qualifying events. So only if at least one of the following qualifying events occurs, an enrollment is completed within 31 days of such an occurrence. 31 days, right? So you really have 31 days after the qualifying event to enroll or terminate insurance for a staff member or for a dependent. First one is appointment or reappointment. Secondly, transfer or assignment to a new duty station. Thirdly, marriage or divorce of a staff member. Then marriage or full-time employment of a covered child. To come back to one of the earlier previous questions, on the exception of termination of children below the age of 25. So marriage or full-time employment of a covered child. Then birth, legal adoption or death. And then the presentation, very important, the presentation of proof of loss of employment and loss of coverage by the staff member under a spouse's health insurance plan. Very important there is that the qualifying event is the loss of employment, right? So if you're enrolled under the plan of your spouse and your spouse loses employment, which is not an own decision, then within 31 days following that loss of employment, you can enroll in the UNHQ administered plans outside of the annual enrollment campaign. Thank you, Valentina.
Can we also enroll in a life insurance during the annual enrollment campaign?
Yeah, I know that I focused very much on the health insurance now, whereas our section is indeed named health and life insurance. We do offer life insurance, but this is not really related to the annual enrollment campaign. No changes should be made now. So there are 2 ways to enroll in the UN Health and Life Insurance administered life insurance plan. It's first you have the unconditional enrollment. That is, staff have 60 days from their date of employment to enroll in the life insurance plan without providing any additional documentation. That's why we call it unconditional. And then secondly, if you miss that 60 days period, you still have the conditional enrollment possibility. What is conditional enrollment? Should a staff member miss the 60-day limitation, enrollment becomes conditional, which means that the staff member will have to submit the Hartford. The Hartford is the insurance company. We work with evidence of insurability form to HLIS for a first review, after which HLIS will forward the form directly to the Hartford for the evaluation of eligibility for life insurance enrollment based on the individual profile, and might require the applicants to undergo additional medical examinations at the applicant's own expense. There also, our website has a dedicated page for life insurance. I really invite you to go there to look on what is covered, what are the enrollment criteria, and also you will have all the forms and guidance material required on that page. Thank you.
Dear Julie, what is the submission deadline for member claims under each US-based plan?
Yeah. So the member claims for reimbursements must always be submitted directly to the third-party administrators, of course, no later than 2 years for Aetna and Empire, and no later than 1 year for Cigna Dental from the date of medical or dental expense was incurred. However, I already want to inform you that Aetna's claims submission deadline will change from 24 months to 12 months, so from 2 years to 1 year, effective January 2022. So claims for services rendered up until 31 December 2021 will still be accepted by Aetna within the 24 months time frame, but as of 1 January, Aetna will decrease the submission deadline from 2 years to 1 year. Thank you.
Regarding special leave without pay, what actions do I need to take upon return to work following special leave without pay?
Yeah, this is one of the only changes in the last I see that might really impact staff on special leave without pay. Not tremendously, but I think it's just important indeed that everyone is aware of that change in enrollment. So upon return to duty following special leave without pay, Umoja will now automatically or already automatically reinstates coverage for United Nations staff members under the health insurance plan and the coverage type in which you were insured before taking a special leave without pay. In case you wish to drop insurance coverage, you can request withdrawal from the plan within 31 days, very similar to other qualifying events, within 31 days of the return from special leave without pay. Failure to withdraw within 31 days of the return of special leave without pay will result in you being unable to withdraw until the next annual enrollment campaign. Again, very similar to other qualifying events there. Thank you.
Thank you, Julie. Another question. Am I required to enroll in Medicare Part B?
Yeah. So indeed, for the retirees among us enrolled in ASHI since the 1st of January 2011, the United Nations headquarters has required all surviving spouses and eligible dependent children, as well as retirees who are enrolled as participants in after-service health insurance and to qualify for participation in Medicare Part B to enroll in the United States Medicare Part B program. This is a requirement, right? So those surviving spouses and retirees who are eligible to enroll in Medicare Part B but choose not to do so will have their claims adjudicated as though they were enrolled. So there will be a big financial impact if you are not enrolled in Medicare Part B but are eligible, because it is a requirement, it is mandatory. Thank you, Valentina.
And Julie, what is the best way to reach the Health and Life Insurance Service?
Yeah, the contact details are in the SCIC, and I think I also shared them during the presentation. But if you ask me what is the best way, please use the contact us form on the website. The website is new. There is a contact us form now. There will be some fields that are required, which will also allow our colleagues to identify the sender more easily, because the UN index number needs to be provided, the name, the organization, etc., which will just allow for swifter turnaround time. So the contact us form on the website, please. Thank you, Wesley.
I have an additional question. Someone is claiming their duty station is New York, but they're currently living in Europe until retirement next year. Can they change to the worldwide plan?
So someone is currently living in New York, and I'm sorry.
Duty station is New York,
yeah.
But they're currently living in Europe until retirement next year.
Yeah.
Can they change to worldwide plan?
So if the duty station is New York, there is no way you can change to the UN worldwide plan. It's very easy, as long as your duty station is New York, you cannot change. However, upon retirement, if there is an option to change plans. It will always depend, of course, again, on your mailing address, because there as well, if you have a mailing address as a retiree in the US, you cannot enroll in a UN Worldwide Plan. So for now, no, but there will be a possibility to, if you're enrolled in ASHI, if you meet the criteria and you are enrolled in ASHI, to change to another plan there in accordance with your country of residence.
Thank you so much, Julie.
I just have an additional, well, this is an addendum to an earlier question. I don't want to put you on the spot, but so in terms of fertilization, you know, there's a lot of question about the freezing of eggs. Yeah. Would you be able to respond to that?
Yeah, I know there are some very specific detailed questions on the coverage of infertility treatment. There's quite some information already available on the Aetna website in the bulletin on infertility treatments. However, and I discussed it again yesterday or the day before with Aetna colleagues, I would really like you to address these questions directly to Aetna. I will make sure, of course, that you all receive the contact information again that was presented on the last slide, which will also allow you to contact them directly. So you can call or send an email and then ask your specific question, whether it is related to egg freezing or any other part of the fertility treatment cycle. I'm still here. I'm just plugging in my battery. Sorry.
Are you willing to take additional questions, Julie?
Here.
You're willing to take additional questions from the extended list?
For sure, yeah. We have time, so go ahead.
I will go ahead, Julie.
Yeah.
I have a problem with my name on the health insurance card. It only appears the first initial of my name, and it has given me a lot of problems at the doctor's office. How can I fix that? I spoke to the carrier and they said it was imputed. It's like that in my by my organization.
Yeah. So I don't think that the third-party administrators indeed can do anything at that point. So with regard to the name that is transmitted to the third-party administrator for UN Secretariat staff, for instance, it is the information that is passed from what is there in Umoja. So I would really encourage you to first go to Umoja through the self-service and see whether your name is complete, whether all the information, of course, same goes to mailing address, any other information that is, you know, like that defines you as a person, as a plan participant. Check Umoja, verify if indeed all the information is there. If you still have any issues, you can of course contact us and we can see what else could be wrong. But to summarize, information in Umoja or Atlas, One UNOPS or SAP need to be correct, and only then that information can be provided, or that information is provided to the third-party administrator. I hope this answers, Valentina.
This is an interesting one. Someone is asking. They're asking, is there any reason why staff in the US are restricted to just 3 health insurance companies, Aetna, Empire, and Cigna? And then they're saying, seeing that there are numerous options that may perfectly suit individuals or family at a lower cost. Yeah.
So no one is restricted to 2 or 3 plans, of course. These are the plans: Aetna, PPO, Empire, Blue Cross PPO, and a Cigna dental plan for dental care are the plans that are administered through UNHQ. Of course, you are free to covered to seek coverage under whatever plan you like, of course. These are the plans that are subsidized by the member states. And already there are 2 options, right? For medical care, there are 2 options. This is also quite unique. So it's either Aetna and Empire. The benefit designs are slightly different. And it's up to you again to verify, to look for the needs of your family, to then check the plan design, to check the limitations, to reach out to the third-party administrators where needed, and see indeed verify whether any changes need to be made. But there are 2 alternatives already offered. Again, these are not just subsidized, these are also self-funded. So it really means that all the premiums that we collect through staff, retirees, as well as the member states portions, they go into the UN operational reserves. There's no premium that flows to the third-party administrators, as they're not the insurance companies. And these premia are used to reimburse the claims. So it is our plans, and these are the plans that are self-funded. These are the plans that are administered through us. But if you would like to seek private insurance, just separately from the UN, of course, you have that's the freedom and that choice available as well. Thank you, Wesley.
Thank you, Julie. Can I ask an additional question?
Yeah. Sure.
Are healthcare costs related to pre-existing condition covered for new UNHQ staff and dependent that would enroll during this campaign?
Yeah. So I think maybe also to link to the previous question, it is again a big advantage of the UNHQ administered plans. We do not do any medical underwriting on our health insurance plans. This means that if you have any pre-existing conditions, if you're, for instance, already pregnant or you have a chronic condition, you can still make changes and you will be covered as of day 1. I think that is very important and very unique, of course, also in the health insurance space. And this is also one of the reasons for that is, of course, that we offer the self-funded plans. They are very comprehensive, many benefits are covered, and on top of that, it also gives you the peace of mind that whatever something happens to you and you need to change plans, or there is a reason why you have to change plans because of a change in duty station, for instance, you will still be reimbursed as of day 1. So I think if there's any additional questions that are not answered in the Q&A and you see that they're very recurrent, feel free to keep on asking them. If not, I think we can come to an end and make sure that the questions and answers are again published on the website very soon. And then I wish you a very nice rest of the day. So I'm just going to listen to Valentina. Wesley, is there any other questions you would like me to ask to me?
Yes, Julie. This is an interesting one. So Aetna and Blue Cross have basically the same benefits, but the question is, why are premiums comparatively higher in Aetna than Blue Cross?
But they don't have the same benefits. I think that is just the main reason. The benefits are not the same. I think that the overview already addressed it quite well. There are some benefits that are covered under Aetna, which are not covered under Empire. So this is really, again, one of the reasons. It has nothing to do with Empire being more expensive than Aetna or vice versa, because again, self-funded plans. But it's really because of the changes in plan benefits, the differences in plan benefits. Yeah, I think that answers the question, Wesley.
Thank you.
Thank you, Julie. No additional question on my end. Perfect.
Well, thank you very much, everyone. I hope it was useful. Feel free to provide any feedback afterwards if you have some. And on the website, you can also provide feedback on any other service or on the website content that you can find there. And I wish you a very nice rest of the day, and keep an eye on the HLIS website to get informed on future events, updates, as well as the recording and the presentation. Thank you very much. Have a nice rest of the day. Bye.
Thanks, Julie. Bye.
You.
Hi, Julie.